610 women in Ohio died from issues associated with being pregnant from 2008 to 2016, according to data from the Ohio Department of Health. It's a scary number for some women, especially those in high-risk categories who see pregnancy as not life-changing, but potentially life-ending. Danielle and Ron Bush are happily married.
We met on Twitter. A true millennial love story.
And after 3 years, they're talking about children.
I don't know. I've always, dreamed of being a mom.
But she knows having a baby may be difficult. The Centers for Disease Control estimates about 700 U.S. women will die this year from pregnancy-related complications.
I don't think that childbirth should be a death sentence.
She has a medical condition, polycystic ovarian syndrome, that makes it difficult to become pregnant and puts her at high risk for complications. So right now, she doesn't want to get pregnant.
It's supposed to be a joyous occasion, but I see so many people that, struggle during that time. So that makes me fearful.
Last fall, the Ohio Department of Health released its first ever report on maternal mortality, deaths from complications while pregnant, during birth, or up to 1 year after birth. Statewide, the pregnancy-related death rate from 2008 to 2016 was 14.7. In Hamilton County, it was 14.0. But the report says 57% of those deaths were preventable.
So we began as a group turning our eye towards evidence-based pathways that could decrease the chance that a woman would die.
Dr. Elizabeth Kelly, interim chair of the OB/GYN department at UC's College of Medicine, says UC Medical Center started focusing on life-threatening pregnancy complications a few years ago.
What drugs to use when, who should be calling the anesthesiologist, how the nurse interacts, makes us function as efficiently as we can in a life-threatening situation.
Dr. Kelly is also leading a new initiative at Cradle Cincinnati to expand their focus to include maternal mortality in partnership with other agencies.
Nope, don't like the numbers.
Like the Cincinnati Health Department.
Why is this happening? And what am I going to do to make sure this doesn't continue to be a problem?
More than 50% of the deaths involved contributing factors from the provider or the healthcare facility, according to the state report. Things like failure to adequately screen or assess risk, misdiagnosis, ineffective treatment, delays in diagnosis. Unfortunately, Black women are even more likely to die.
Is racism. Black women are being treated differently.
According to the report, the pregnancy death rate for white women is 11.5. For Black women, it's 29.5, an 18-point difference.
What's important is that it has now been recognized as a significant issue that needs to be addressed.
Dr. Roosevelt Walker is president of the Cincinnati Medical Association.
Most of the healthcare networks in the city have begun teaching sessions on implicit bias and how to rectify that.
As for Danielle and her husband starting a family,
I want to be positive about things. So it is still in the air, but I am very fearful.
Lisa Smith, WCPO 9 News.